As we all know, hypertension or high blood pressure is a disease which is pretty common in our society. So it is aptly called as a silent killer because blood pressure does, it may not give any warning signs or symptoms, but it can cause a major health scare. We all know that it is a risk factor for heart disease, but it can also affect your brain health. How does it affect your brain health? So high blood pressure, it damages the blood vessels supplying blood to the brain, and that can cause clots formation inside these blood vessels, which can lead to ischemic stroke or paralysis. Apart from that, high blood pressure can also weaken the walls of these blood vessels, which can rupture and give rise to hemorrhagic stroke, causing again paralysis. High blood pressure can also affect the small blood vessels inside the brain, which can result in memory disturbances or dementia. So we should all take steps to reduce your blood pressure or control your blood pressure and achieve good brain health. How can we do this? So I am going to tell you 5 steps for this. The first step is stay active. If you are leading a sedentary lifestyle, you should do regular exercises. Even moderate exercise for 30 minutes a day for 5 days a week is also enough to achieve good health. So exercises may not mean that heavy exercises in gym. You can do routine aerobic exercises like walking, jogging, or even cycling and dancing. These all can help you in reducing your blood pressure. Number 2 is eat healthy food. So for hypertension, it is very important to control the intake of salt in your diet. You should also reduce intake of saturated fats. We all know that packaged foods, they have high salt content as well as saturated fat content. So as far as possible, you should avoid packaged food. Try to include more of green leafy vegetables and fresh fruits in your diet. Apart from that, if you are taking alcohol, limit the intake of alcohol. Number 3 is reduce your weight. If you are overweight, you should try to reduce your weight to a level which is appropriate to your height according to the appropriate BMI levels. So you should do regular exercises, and if you follow a good diet pattern, it is very much achievable. Even if you reduce 5 kgs of weight, it can reduce your BP by 10 millimeters of mercury. Number 4 is manage your stress. It is very important to manage stress. Nowadays, everybody has some or the other stress, but if the stress is long standing and persistent, it can harm your health. So you can do regular meditation or some mind relaxation exercises. Apart from that, sleep is very important. You should take at least 7 to 8 hours of sleep every night to keep your mind fresh. You should have more interaction with your family and friends so that your mind is relaxed. Number 5 is reducing nicotine intake. If you are smoking or taking nicotine in the form of any form of tobacco, you should reduce it. Nicotine damages your blood vessels and it causes high blood pressure. It is a risk factor for heart disease as well as brain diseases. So any form of nicotine, try to stop it. Apart from this, if you are already taking medicines for blood pressure, then you should take these medicines regularly. I have seen many patients stopping these medicines once the blood pressure gets under control, but that should not be the case. You should follow the advice of your physicians to reduce or adjust the doses of these medicines. You should also get a BP reading machine at your home so that you can measure this BP regularly and have a check on your BP. All these things may seem overwhelming to you, but I would suggest take one step at a time and try to get into a habit. If you get these healthy habits, you can lead a healthy life. Thank you.